Technical excellence in medicine is necessary, but it is not sufficient. For patients navigating the complex journey of peripheral artery disease, that poor circulation in mainly the legs, the quality of human connection with their physician can be as important as the procedure performed itself. Dr. George Adams, interventional cardiologist and director of cardiovascular and peripheral vascular research at UNC Rex Hospital in North Carolina, exemplifies the profound impact of combining cutting edge technical skill with extraordinary compassion. Throughout his distinguished career spanning clinical care, research, and education, Dr. Adams has maintained a steadfast commitment to seeing the whole person, not just the disease. His patients consistently describe encounters characterized by his full presence, active listening, and genuine empathy that makes them feel truly seen during vulnerable moments. Now, what makes Dr. Adams' compassion particularly remarkable is how he maintains this human connection despite the immense demands of his multiple professional roles. When a patient needs him, everything else pauses. We've heard accounts of him actually interrupting live and educational broadcasts or going up and seeing patients in between two live broadcasts to actually check on a patient from the previous day. A small gesture, it may seem to the doctor, that speaks volumes about his priorities and means so much to these patients. His responsiveness extends to his willingness to help patients who have exhausted all other options. When the Global PAD Association reaches out with urgent cases that have come across our Leg Saver hotline, Dr. Adams, no matter where he is in the world, consistently responds with immediate, compassionate intervention. In a healthcare environment increasingly defined by time constraints and technology, Dr. Adams reminds us that the art of medicine, the human connection between doctor and patient, remains essential to true healing. So that is why I want you to join me in welcoming our 2025 Compassion and PAD Care Award recipient, Dr. George Adams. Welcome, Dr. Adams. I can see you did not expect that.
Yeah, Kim, thank you so much. It's an honor and privilege.
But it
Yeah,
certainly
means a
resonates,
lot.
doesn't it?
Means
It's
a
stuff that
lot.
you just do inherently. This you don't even think twice about it.
Yeah, people in need. We tend to give more than we receive, and it just feels good. So, I don't know what to say. I'm just very humbled. Thank you very much.
But I'm curious, I'm sure that when you got into medicine, it was really the patients that got you passionate, right, about it. But a lot of times, with all of the demands, from the research, the education to everything else, all the paperwork, the documentation that you have to do. I mean, you're being pulled in all these different directions, and it's really easy to lose that human connection and remember that you're here for the patients. And when they're sitting in front of you, you can't be thinking about all these other things that are tearing you in a different direction. You have to be present because they're the reason you're there. But it's easy, right, to lose sight of that. And first off, I'm curious what got you into medicine and defined you as who you are in terms of your compassion that is unprecedented. I mean, it is above and beyond what any normal doctor who even is compassionate would do.
Yeah, Kim, you're taking me way back now. So, you asked me why I became a physician. I was going to become a mechanical engineer, and that's the reason. That's what I went to school for, actually.
Oh, wow.
And then I realized that I liked people interaction, and then there was
Yeah.
a piece of me that always was curious about medicine. And what I mean by that is growing up on a farm in the southern part of North Carolina, raising cattle, tobacco, potatoes, all kinds of different things. that I lived at home. My parents worked, and my grandfather lived with us, and my grandfather had Alzheimer's disease.
Oh,
And I
wow.
still remember being young and having
Yeah.
him by my side. He used to play football for NC State. I mean, he was a strapping gentleman, very sharp. He was a teacher, was in the military, very strong religious beliefs. I mean, just a strong character of a person, but he couldn't remember. But so my mother left me home with him because my mother and father had to work. And at the age of 8, 10, 12, and on up, I mean, I was the person that more
Yeah.
or less was able to remember and was capable. But ultimately, he was like a big kid as well. And he
Yeah.
was the person that was able to perform physically what we wanted. But in terms of medicine, I grew up with that type of role model, I guess you would say. He was almost a kid in a mature adult's body, and it made me appreciate not only him, but the ability of another person to influence another, right, and to help another. And we helped each other and we worked together, sort of like patients, right? It isn't just a physician that helps a patient; it's a patient that helps a physician, and physician that
Yeah.
helps a patient, and it's teamwork. So I think that was probably the inciting event that probably really pushed me toward medicine.
And how do you think, what is it that is your secret to maintaining the same level of compassion from day one, or and even exceeding what it may have been on day one?
Yeah. So every person is individualized, right? It's a personalized approach, like we'd always like to say, and every person matters. Right,
Yeah.
and people, it's hard to see someone suffer, right? So if you can decrease or alleviate that suffering, it means so much. And it's each person, right? Each person independently, because at one point in time, each one of these people were independent, and now they're dependent on the system because of their ailment. And if we can get them back to a point where they're independent, man, you've helped out someone more than you could ever help them. I mean, it's just a very, very gratifying.
One of the stories that stands out to me, and I think you would remember the case because she is the one that made a point to text me from her bed to say, "Guess who just came up to visit me?" And I said, "That's impossible because I literally just watched him live at this conference educating doctors on a particular case, and he has another one coming up right now." And she's like, "He was just in my room." She was a wonderful little lady that all she wanted to do before she passed was to continue to play the piano. She wanted to be able to play the piano again. And the doctor over at another area hospital wanted to cut off her leg. And she said, "If I'm going to die, I'm going to die. Like, it is what it is, but I want to die with my leg. And I want to play piano until the day I die." And I think she was able to survive maybe even another year or maybe 2 years. I just can't remember. But you had an impact, a profound impact on this woman, and honored her wishes to keep her legs attached so she could live a better quality of life. And that to me means everything.
Yep. And she became independent, right? She was
Yeah.
dependent, and she got to do the things that she likes to do in life. And this story is one of many, right? I had a For her, it was one. For it was another that was a farmer that wanted to go be able to pick sweet potatoes with his boys, right? He was diagnosed with cancer. He couldn't walk, right? So he couldn't get outside. There are other people. I mean, there's multiple stories, but at the end of the day, um, just giving people the opportunity. And Kim, let's make sure we understand this. The physician that didn't work on her leg is probably because he was trying to do the right thing for the patient. He didn't have the capability or the facilities or the equipment or the
Yeah.
know-how, regardless. But then you see yourself in your program, she was able to find a program to connect them with people that could help her, right? So it's a testament to what you're offering as well. So again, this collaborative of communication and ability to help people is what's so worthwhile. And then you're able to give them to me, and I just used my skills that I typically use, and we were successful, right? The patient, you, myself, and to be honest with you, hopefully it opened up the other physicians' eyes to see what was capable and what was available.
And I tell patients all the time, that the doctors aren't trying to ruin your life. They're not doing amputations for fun. It's literally they are doing what they know. They're doing what they're most comfortable with. Not every doctor is comfortable with creating the evidence. So they wait for the evidence and they do what their skill set is. They don't think our philosophy is instead of giving up on the patient, give up the patient. But there are some hospitals that that's not part of their
Yeah.
policy. That
And
the culture, right, is right, wrong, or indifferent. It's not something you're, but the culture makes you feel as though, and I've been told this by several doctors, that you can't reach out for help. That patient went through this department. They called the department. You were the one that was available. They're your patient. Do what you know. We hired you at the hospital because you know. You start shuffling them around and it becomes a cost burden. It becomes a hassle. We have enough patients. Just handle it. And so, because of that, some doctors just say this is the only option. Although we still wish that they would say it's the only option I have, you may be able to find different options elsewhere. I'm too busy, heads down, with all the demands of documentation, of clinic, of procedures that I literally cannot put my head and pop it out enough to see the new innovation that's happening. So if you find something, more power to you. And I just wish more doctors would just say, you know what? All I have is amputation. You're not going to die if you go home and you go find another opinion. I can't help you find it. I don't know. But if you want to have an amputation, that's what I've got.
yeah, no, and you're right. And sometimes patients become a victim of the system rather than a victim of care per se, right?
Yeah.
So I just like to believe that I always try to believe that try to look at it as positively rather than negatively. That it's more ignorance rather than intent. Right. So
Hmm.
if we can continue to educate the public, and when I say the
Yep.
public, it's just not patients, it's physicians, it's healthcare systems, et cetera. And don't get me wrong, a driving force is always cost. We all understand that. But if the right thing to do is to get them to another facility, another physician
Yeah.
at that facility, it's important. And Kim, let me tell you that I had a patient just the other day, actually, it was this past week, that showed up in the ER with a note with my name on it from another facility. So the other
Wow.
facility couldn't do it and said, you need to go to this emergency room and ask for this physician. And they had my name on this thing. So it makes
It's
me
awesome.
believe that the impact of what we're doing
Yeah.
is it's making an impact. Maybe they couldn't get them transferred, but they told the patient what to do, who to ask for, and where to go. So it just made me feel good. And again, it was a positive outcome for the patient who ultimately would have lost their leg.
And I'm sure you've had situations where a patient has had to lose their leg. And I like patients to know again that it's not only a bad day for you as the patient, it's a bad day for the doctor too. Can you describe one of those situations that still, sticks with you today that you just wish that there was maybe, that there was a technology or a technique that just hadn't been invented yet?
Sure. And Kim, don't get me wrong. I don't like failure. And I think you know better than anyone, I don't like failure. And most people say that, that are around me, I have a lot of patience and perseverance in trying to be successful.
Yeah.
And so that's one of the good things about me. However, there's never an always, right? There are times that we've exhausted everything.
Yeah.
And if you don't do something, it's a last resort is amputation. then it could ultimately compromise their life. So don't get me wrong, if that comes to fruition, I feel like a failure at times, but then I understand that at the end of the day, we did everything we knew possible. But now we have just changed the story. Now we have to deal with an amputation, and the most important thing is that you have to stay mobile. You have to move. If you
Yeah.
don't move, you will continue to lose it. So you gotta move it, right?
Mhm.
So saying that, then we deal with the situation, we get our prosthesis, and then I am now your drill sergeant, and I am
Yep.
going to be on your butt because you got to move, right? And so that's we deal with life, we deal with bumps in the road, and we continue. And Kim, there are times that patients come to me after they've already had an amputation of one leg, and now they're with me because now
Yeah.
they got a wound on the other leg, and they're at risk of amputation. And there are many times I'm sitting there, and the patients ask me, if I would have known you sooner, would you have been able to save my other leg? And of course, there's always a possibility I could have.
Yep.
But regardless, this is where we are now. So we're going to continue to move forward. That's it. Life is too precious. And Kim, we're all going to be born and we're all going to die, right? We
Yep.
know that. But while we're here, right, we have purpose. You continue to push yourself. I mean, you're here for a reason, so use it. You have a precious life. Use it while we're here.
I totally agree. And, I've had, patients that there's one actually that we share. And what's so frustrating is when they've had such a horrible experience with all of their care. This one patient has had what, more than 50 or 60 procedures. He's felt like a guinea pig. And we finally, he just fears going to the doctor, and he will sabotage every single opportunity to go. There was one situation where you were kind enough, you were out of the country, and you set him up with the nurse practitioner. And you said, the number one thing you need to do is make sure that he tells the guard that they need to call up for the nurse practitioner, that they're there waiting for him. And it cost us a $400 cab ride to get him there. And he gets there, goes to the door. The guard says, there's no one here, we're closed, and doesn't say what we told him to say, gets in the car. And that's when the cab driver was like, because I had talked to the cab driver, and the cab driver says, well, did you do that? And he said, no. He goes back and the doors are already locked. And it was like, oh my gosh, and your other doctor said you're going to lose both legs. And then fast forward, you finally do see him personally. He felt so much compassion and love for you. And then the day of the procedure comes and nope. And these patients are scared. And at that point, you can't force someone to go in and save their legs. You can't do the I told you so if they go and end up in the emergency room and get their legs cut off when they had the chance. S- you have to come from a place of understanding with these patients. And I'm sure you've had other ones like that where you're like, I could have saved your legs.
Yeah.
Why didn't you come back? Why did you go back to the other doctor? Why did you wait? You're showing up now in the emergency room with maggots in your wound.
Yeah. Yeah, no, and I get it. And it's frustrating. It is. But let me tell you something. If someone goes out of their way, and this is what I tell all my patients, when I'm going to be here, what days. Sometimes it's very difficult to get an appointment with me. If you
Oh
have a
yeah.
problem and you show up on this day, I will see you. You
Mhm.
will not be turned away. I will see you. You may have to wait, but I'll see you. Right? If the point is this is if someone is willing to go out of their way. And I get it. It's tough, especially if you don't have the means. And it's embarrassing, right?
Yeah.
Whatever that may be. Okay, I get it. And don't get me wrong, I'm not perfect. I'm not. And at the end of the day, there's a lot of things I wish I was that I'm not. But if you aren't going to judge me, I sure as hell won't judge you. So if you come on in, I will see you. right? I
Yeah.
would, and I'll be honest with you. I'll tell you the way it is. If there is an opportunity, if I can throw that ball in the end zone and you're there to catch it, man, I'm going to throw it, right?
Yeah.
Or vice versa. If you're willing to throw it to me, I'll be daggone, I will catch it. You just throw it up there, I'll catch it. So, the point of that is this: is that it's a team effort. It's you, it's me, it's the patient, and everyone has to put the time and effort in,
Yeah.
but I will tell you the door is never closed, right? And I get it, right? There are times that things happen, and if you can't make it happen or it's not the result that you wanted to make happen, okay, that's okay. Just
Yeah.
get back on the horse and get your butt in here. That's it.
Yeah. You can't live in regret. And you've alluded to it a couple of times. It's just when you have the patients where um, you save one leg and they had already lost one, right? And then they're like, you could have saved that other leg. And I've had a couple patients like this. One that we had in North Carolina, and he was from South Carolina, and he had already lost his leg. And it turns out it was a short focal lesion in the iliac, and they wanted to do a BKA, below knee amputation. I mean, weird. I don't understand it. And he, it was opened, and his wife calls me a few weeks later. She's like, I'm so upset. You got him to stop smoking, and now he's smoking again. And he knows that if he smokes, it's going to make it worse. But he has fallen into this deep depression because now he regrets losing his other leg, that he feels as though now it could have been saved, and he's living in a woulda, coulda, shoulda. And I had another patient just the other day I was on the phone with, that I was hoping to get a testimonial from him, because he also lost his leg, and he ended up coming to us, and we were able to get him to Dr. Jaffer Golzar over in Chicago. And he used that minimally invasive bypass PTAB to open it up and get blood flowing. And he actually said this to me. I'm not, and I apologize to anyone if this is offensive, but he says, now I'm an angry black man. Like, I never thought I would ever be an angry black man. He's like, but you can quote me on that, because that's what I am, because that doctor should have never taken my leg. And, I'll be darned if I let anyone, else go to that doctor ever again. And, on and on. And he's like, I just don't know what to do with this information. And I said, well, the thing that you have to consider is that innovation is moving at the speed of light when it comes to PAD, right? New stuff every day, and it takes time to roll out. And your doctor, as you said earlier, just may not know what he doesn't know. They can only offer what's in front of them. And that's why we're trying to educate the patients. The patients are already Dr. Googling. They're using AI now. They're using Chat GPT. So it's really important that if you are on deck for an amputation, or you're having any procedure at all, to make sure to get a second opinion, get a third opinion if your life is not on the line, right?
Yeah. And I agree, Kim. And the other thing too is be an advocate for your own health care, right? That's most important. I mean, how many people have come to you? If you would never have known what these people existed. I would never have known these people existed if they didn't reach out and take control of their life. They don't settle for one answer. So I think it's so important. I agree.
Yeah, it's hard. I was having a discussion with some of the folks on our new medical board, advisory board, and the other day, and they were saying it's really hard for patients to know how to choose a doctor. And there are some doctors that don't want patients to know how to choose a doctor for limb salvage. But I think it's just like with any cancer, patient, and a cancer doctor, an oncologist. Some focus on pancreatic, some focus on breast cancer, some focus on prostate cancer. Like, it runs the gamut. Some focus on brain tumors. And so it's not a knock on the doctor. There are some doctors that can do everything, right? But there are other doctors that need to say, you know what, I specialize. And we have one doctor in Indianapolis, and she is a rock star at iliacs. She's like, I only want to do CTOs of the iliacs. I have enough of those patients. Send them my way. I've got this. And so that's all she wants to do. And she told me point blank. Do not send me anyone with tibial issues. No below the knee issues because I just don't do them. I can't do them.
Perfect.
And so we
And
just need to create a resource that's available where doctors are honest about this is what I can do.
yep. And it's not just that, it's just opening up the barriers of communication. Right? There are many a times that people see, and I do a lot of these, right? I'm very successful, but there are
Mhm.
many a times that I've got somebody on the other line, or I'm FaceTiming another physician outside the US, for example. We were talking about Singapore earlier, and us get them on the phone, say, listen, I've got this. You were telling me about this new thing. Do you think this is an appropriate candidate? Right?
Yeah.
So it's not just the best of the best. It's also the best of the best, realizing that there are still people out there that do
Options.
things a little bit different and maybe a little bit
Yeah.
better, and we can all learn. So,
Yeah.
um, yeah, I know, I appreciate it, and it brings the community together,
Yeah.
right?
I love that.
Rather than divided, right? And it's not about discipline. So, growing up, becoming a physician is there are all these different silos, right? Cardiologists, vascular surgeons, radiologists, et cetera. If you can somehow break down those barriers and everyone can work together, man, how much more powerful is it
Yeah.
for the benefit of patient care? It's huge.
Well, there
So,
are enough patients to go around, and especially more to come with the diabetes epidemic and increasing number of chronic kidney disease patients and ESRD patients, right?
yeah, no question.
Unfortunately.
And Kim, you look at it, you mentioned that, but it's true. People are getting older. More people have diabetes, and the number one
Mhm.
cause of end-stage renal disease is diabetes. If you look at current studies, whereas you knew it was a good study when I was coming out in the early 2000s, if you had 20% diabetic, now there's studies showing 40, 60% of the population they're studying is diabetes. It's at least doubled. It's incredible.
Yep. And, I'm curious just with all of these patients and your time here, your time, there, and there's so much going on that patients, we talked about this with Dr. Marco Monzi on our The Heart of Innovation podcast earlier, actually, today, that you also have a life. I mean, you even have a ranch, you have a family. I mean, you have responsibilities. And Dr. Marco Monzi, who won our Lifetime Achievement Award through the Global PAD Impact Awards, um, shared a story of a moment where he learned a really big lesson in compassion, and it became just a huge reminder of why he's doing what he's doing and the commitment that he made when he took his oath. And he said, I wanted to go to the gym at the end of the day, and I knew that I needed to finish by a certain time to go to the gym so that then I could get home and be with my 8-year-old daughter and spend time with her before she goes to bed, or else I don't get to spend time with her before she goes to bed. And so he started this case, and it was complex. Of course, I don't think there's anything that Marco Monzi does that is not complex. And he tried his best, did it one time, tried antegrade coming down from the groin to open the blockage with wires and balloons. And then he tried retrograde coming up from below, with a poke in the foot, access in the foot. And he was like, "You know what? I've been at this for 2 hours. You know what? I don't think there's anything else that I could really do." And so he said, I'll just send it, to amputation." And he said, then he thought about it. Well, why am I really doing this? Why am I giving up on this patient? I wouldn't normally give up on this patient. Yes, I'm allowed to have a life. Yes, I'm allowed to have limitations, but me going to the gym and sacrificing this man's leg because of it, I can't live with that. That's not okay. My priority has to be my patient. They're coming to me and they trust me. And he chased him down the hall as they were bringing him to the OR and grabbed him back. And it took another 2 hours, but he got through. And here's the amazing thing, 12 years later, the man still has his leg today. And he said it's such a great lesson, not to say that people can't have a life, but he said, I have to recognize that not everyone can do what I do and that these patients put trust in me. And You also worked with Dr. Monzi. You've been in his cath lab. You presented his conference. Obviously, you align. And, great minds think alike, right? And I would imagine that you've had a case or two or 10 that are like that, where you do have that conflict.
Yeah, no, there's no question. Kim, first of all, Marco Manzi is amazing. I mean, he's a testament not only to how the field should be, but how a person should be. Just a big heart, just incredible, and he really works to the benefit of the patient and to the community as a whole. So I applaud him for number one winning your award, but very well deserved, no question. Just outstanding, very well respected. But going back to what you just said is it's difficult. All of us have sacrificed to be where we are, right? And a lot of times it's our families that have sacrificed or our own, well-being, whether it be, working out, whether it be getting enough sleep, etc. People always ask me, am I balancing life? And shoot, I'm the worst person. I don't even know what that word means, but I
Me
agree
neither.
with Dr. Manzi in the sense that that our conscience, you can tell it's not a good physician, it's a good person, right? Someone that has a conscience, something that it bothers them that they didn't do the best job possible. It bothers them that they failed, right? If you ask me today, George, tell me about all your good cases, I'd struggle a little bit. If you ask me about the bad cases, man, there's not many of them, but I can remember every one of them.
Yeah.
Okay, because you stay up at night, just like Marco, I would do the same thing. I stay up at night and I replay it in my head, right? And have there been times that I failed by through one perspective and overnight I dreamt about it and thought about it, etc. And then went back to that patient and said, listen, you just got to give me one more shot. I told you this was the last shot, but you got to give me one more. I think I can do something. And many a times you are successful bringing them back. You do something a little different. You learned from what you got into to begin with, and you don't get into that same situation. So I agree wholeheartedly with Marco. And there's several people out there. You asked me, is there one inciting event? I'm self-taught in terms of, and most of us are. Marco's self-taught. Mariano learned from Marco. I mean, there's several people that we know that are self-taught, and I still remember in the early 2000s going to Germany, Leipzig, Germany, to Link, and sitting in the back of the room and seeing Andre Schmidt do 40 live cases and the toughest of the toughest. And I'm sitting there going, holy cow, there's somebody else that does this stuff, right? I just didn't know. And I felt like I was a kid in a candy store or I'm in a movie theater eating popcorn. I mean, it was incredible, right? And then what that did is it brought the communities together, right? Now he's a very good friend, just like Marco, right? There's a tight knit group of people around the world that do similar things, right? So, if you wanted to talk about an inflection point for me, that was probably one of my inflection points in this career to realize, listen, we got to do this. And then shortly thereafter, Jihad Mustafa and I started AMP, or was involved with AMP, and it just everything continued to snowball. So it's been a wonderful ride for me.
Yeah. What was that defining moment where you realized that failure was not an option? Was there a specific case where you said, there's got to be another way? And I'm trying my best. I've got to go and seek out other options elsewhere because this particular patient, I just feel in my heart of hearts, in my gut, that there has to be something more. And I just can't put my finger on it.
Yeah, and Kim, I think that's how we're brought up, right? There are doers and there's non-doers, right? And I still remember growing up, if I didn't know how to do something, I never told you I didn't know how to do it. I figured out how to do it, right? And I think we got to get in that type of mindset, number one, because if you don't get in that mindset and you aren't patient
Yep.
you got to have patience, right, to do this type of work effectively. that you're not going to be successful. But once you get hold of that, then you learn the skills, you learn the devices, you take your time, and you're successful. It's those three things, in my opinion, right? But was there a turning point saying, listen, there's an opportunity to save someone's leg or save someone's arm or to do something differently? And this extrapolates to vascular disease. It's not just the legs, the arms, the hearts, the carotids. I mean, I work on just about everything. The defining moment is when you said, listen, I'm not going to settle for non-success, right? I'm going to
Yeah.
do whatever I can to be successful. And I think that when you start to realize that if you actually try and you give it your best shot, that a lot of times you can be successful. And it sort of it re-emphasizes what you're doing. It gives you that motivation.
I love that. And we have a certain set of questions that we ask every doctor, and you've already answered the defining moment. But I'd love to ask you about a case, so a specific case that you learned a lesson from that other physicians, I'm sure that there's a million of them, but a case that other physicians and clinicians can learn from, that you learned a pretty valuable lesson, whether was a success or whether it was a failure. Can you
Yeah.
share a case?
Yeah, sure, sure. So, and this is in general, but I think it rings true, is that there are multiple cases that are sent to me that a person has a wound, for example. And a lot of times it's a mixed picture. What I mean by that is it's arterial and venous, right?
Yeah.
And a lot of times it'll get billed as just venous. This isn't an arterial ulcer. But the thing is, if you don't take, first of all, you got to take the angiogram. And let me tell you, stats in the United States, 1 out of 2 people don't even get an angiogram when they have an ulcer, right? Which is astounding. But first of all, you got to take a look. The second thing is, it may be really bad, right? The reflex is, if it's really bad, then maybe I can't do it. Maybe that's not the right answer. You got to try. Put a wire down there, use your skills, and see if you can cross the thing. Because there
Yeah.
are many that with minimal, you don't need a lot of knowledge to cross these. You got to
Mhm.
try,
Just got
right?
to try.
Yeah. So, and a lot of times these lesions, I mean, there was one just this past week that's what was billed to me. It was a long chronic total occlusion of a it was a posterior tibial artery. And literally, I took a floppy tipped wire down there and it crossed, right? And it's nothing special I did. It's the only thing that was different between me and the other people was that I tried, right? I didn't say, listen, this is too bad. It can't be done. So, and that saying of hibernating vessel distally is true. There's typically vessel that's distal. You can't see it because it's not perfused. But once you get through it, the vessel is open distally. You can inject, and now you've got a target, and you can open it
Mhm.
up. So, so that's what I'd leave you with that question. I think just an arterial and just if something's billed to you, if they first of all, if they've got an ulcer, do an angiogram, right?
Mhm.
Number one. Number two is if it's something that's bad, try. I'm not saying if you try and you can't, then I get it. But then, as you have said, make sure that you contact someone else and just get a second opinion before
Yeah.
someone cuts your leg off.
Exactly. The number one thing that I'm seeing of late are aortobifemoral bypasses and axillary bifemoral bypasses with no one ever trying a an angiogram. Oh no, we can see it. It's blocked. Can't do anything. But I will tell you, every single one I've sent to a second opinion, they've always been able to get through with a wire. So you were one of the ones that taught me, and it was at Click that literally you have to go in. There are things that you can't see in a CT angiogram that you can see with intravascular ultrasound or what's called IVUS.
Yeah. Yeah, you're absolutely right. And so you get a different perspective. But
Yeah.
again, if you never take pictures, you never are able to even answer the question. It's sort of like pitching the ball, right?
Yeah.
If you pitch somebody the ball, you got a shot at hitting it. But if you never pitch the ball, you aren't going to hit it.
Mhm.
So again, you got to at least try. So that's one thing that I think rings true with this patient population.
Okay. Describe a case, and I'm sure you have a million of them, where a patient should have been diagnosed with PAD sooner, but was not. And because of that, they presented on deck for complex revascularization or amputation. And We use this in particular to raise awareness of the delays in patients seeking care due to, yeah, they might have their own reasons, but also due to misdiagnosis. We have so many patients, we want to raise awareness. If you have been told you have gout, if you have been told that you have back issues, if you have been told that you have diabetic neuropathy, whatever it might be, if you've been told that, then still get a second opinion. Um, and so a lot of these patients don't, and they end up way too late. So if you have a case like that that you can share that patients can learn from and have a call to action to stand up and question their doctor, um, go ahead.
Yeah, so I agree with you. And the common thing are the diabetics, right, that have peripheral neuropathy, right?
Mhm.
They have pain or they have no feeling, but something is progressing to the point that they change their behavior, right? In terms of not exercising because it hurts, right? But someone has billed it as either musculoskeletal or arthritic, you're getting older, or maybe it's peripheral neuropathy,
Yeah.
right? And it's a neurologic problem rather than a vascular problem. Okay, so what happens is treatment is delayed. You change your behavior, right? So you don't exercise. And let me tell you something a little bit funny, right? So you also got to ask the right questions as a physician, right? And let me give
Mhm.
you an example. So you're my patient, and you come in to see me, and I'm like, Kim, well, what brings you in? Well, one of my doctors said I should probably come see you because my feet's changing colors, right, or something. And then I go, okay. I said, well, Kim, have your legs been bothering you? Oh no, my legs aren't, they don't bother me at all. And I say, okay, all right. Well, how many flights of stairs can you walk? And you look at me and you go, well, I don't really walk stairs. And I said, okay. I said, well, how about if you and I walk stairs right now? And if you and I are going to walk 2 flights of stairs, and you go, well, I'm not going to walk 2 flights of stairs. Well, why aren't you going to walk 2 flights of stairs, Kim? Because my legs hurt. And I said, whoa,
Yeah.
whoa, I thought you just told me that your legs don't hurt. You go, well, you know what? They don't. And I say, well, why don't they? You go, because I don't walk. And so, it's almost like a mind game
Yeah.
with some patients. But going back to this is that now someone has changed their behavior and almost it's the perfect storm. And what I mean by that is this: remember, all your vessels in your body are connected. And people who have critical limb ischemia, rest pain, for example, their number one cause of death is heart disease and stroke. Why? Because it becomes stagnant in the vascular. I mean, it just becomes just a bomb. Everything else builds up in the heart and the brain. So now you're predisposed to stroke and heart attack, in addition to developing wounds on your feet and possibly losing your leg. But your question to me is what's that patient population where people have said it's something else, they haven't done a thorough assessment, and they just missed it. Well, that's an
Mhm.
example. Diabetics with peripheral neuropathy, older people who have arthritic changes, they can't walk, they're having pain. They've been told that it's their back, it's their
Yeah.
knees, it's their nerves. Those are the people that really got to put their antennas up and go, you know what? There's something wrong and we
Yeah.
need to figure it out.
It's so interesting. I just had this conversation yesterday with Dr. Mark Banaka in Denver, and he was the PI on the STRIDE trial for semaglutides and how they increase the walking distance for patients with diabetes and PAD. And he said the exact same thing. He said, I no longer ask about textbook symptoms. Do you get leg cramps when you walk? I ask, do you have trouble walking? How far can you walk today versus a year ago? And
Sure.
he was going along those same lines. Versus you can't ask just that simple question when it comes to especially diabetics, because they just don't know. It's just an automatic behavior. And the same goes for the heart. I'm sure you get the same thing with
Yes,
people
sir.
who end up saying, like, for example, my dad, the doctor said, well, how are you doing? I don't have any chest pain. Okay, you don't have any chest pain. Well, the next doctor said, what could you do a year ago that you can't do today? And what modifications have you made? Do you take the stairs or do you take the elevator? If I asked you to take the stairs, would you take the stairs with me right now? And he's like, no, I'd be winded.
Yeah.
And so it turns out that he had a 90+% blockage in his right coronary. His LAD was 85% blocked. And he would have been dead in a few months, according to the second doctor, if my dad didn't seek a second opinion. So I love that you brought up the different way of asking those questions. It is about asking the right question, you get the right answer.
That's right.
So, share a story of a patient who impressed you with their effort to improve their PAD prognosis through their own perseverance. We had, for example, Dr. Vincent Rowe, a vascular surgeon out of UCLA, who shared the story of a patient on deck for amputation, didn't have a wound, but literally no flow, completely blocked. And she ended up on her own going out and adopting the art of grounding. And she spent hours each day on the beach, on the grass, got a grounding pad. And a year later, she still has her legs and she has no complaints.
Yeah. So I'm gonna give you a little bit of a curveball with this answer. So this is a 60-year-old African American female, one of the most lovely individuals you'll ever meet, right? Ball of energy. She's lost her left leg, right? She lost it. It's an above the knee amputation. And the reason she comes to me is because she's gotten an amputation and the wound where they did the amputation on that left leg will not heal, right?
Yeah.
So she goes, what do I do? She goes, I've got to exercise, right? I can't put my prosthesis on. I can't walk. So I said, okay. So I take her to the lab. I do an angiogram, and her superficial femoral artery, the artery in her thigh, is completely blocked. The reason she probably got the amputation.
Yeah.
So then I go, okay. So I end up opening the superficial femoral artery, probably the reason she got her amputation, and she healed the nub such that now she's fully functional. She wears her prosthesis and she's able to exercise, right? Again, saying that, you know what, we're dealt some cards, right? She's already had an amputation. We're there. Okay. Now we got to get you moving again. And this lady took it in her on her own on her own
Of
on her own, whatever word I'm trying to use, to find
course.
me, to get this, to get something,
Yeah.
to get her leg open, to get the wound healed. So again, I mean, this is a person motivated, someone that's already dealt a bad hand and doesn't look at it this way and just keeps pushing. And
Yeah.
she's done it. And she's exercising today. She's using her prosthesis and doing excellent.
Yeah. Oh, I love that story. So here's a fun one for you. I've never asked you this, but your good friend, Dr. Anita Dua, has literally landed by far the best motivational speech for walking is medicine with 30,000 views. So I'm curious how competitive you are in offering your best motivational speech. And if you want, I could give you a couple examples, but your best motivational speech to me as a patient that I need to walk, walk, walk. Why does walking matter? What does walking do? How do those natural bypasses grow? Is it kind of like a freeway where you're creating detours? Is treating your walking regimen like being in the gym with the trainer just sitting, saying, "Give me one more rep. Come on. Oh, but it hurts. It hurts. Oh yeah, feel the burn. No pain, no gain. You got this. Just one more rep, one more step."
Yeah. So no, I love it. I mean, all of that is true. But in my opinion, if you don't use it, you will lose it. Right.
Yeah,
And the most important thing is to realize is the exercise that you do not only saves your limbs, it saves your life. Right.
yeah,
You prevent heart attack, you prevent stroke, and you prevent losing your toes. Right. So everything that you do from a exercise standpoint is beneficial. And my ultimate goal for you is not only to keep you here longer, but to keep you here longer doing the things that you want to do. Right.
yeah,
And then the other thing is this, my motivation for you is you're on a whole bunch of medicines. If you get it moving, you drop your weight, you'll get your blood pressure under better control. I will drop some of these medicines. You'll get your diabetes under better control. I will drop some of these medicines. You'll get your cholesterol under better control. Again, I will drop some of these medicines. So if you do what you tell me you're going to do, I will do what I tell you that I'm going to do. So I think that's, you're taking a hold of your life.
yeah. I love that. That was really powerful. You almost made me tear up.
Okay.
Um, two more questions, and we'll let you get on with your Saturday. But I think you'll like the last two questions. So one is really aligned with your award that you have, the compassion in PAD care, and a lot of times I think the doctors, their intent is really to be compassionate, right? But a lot of times you go in and patients aren't prepared for their appointments. They're talking about the flu they had when they were 15 years old, and they're not getting to the point of that would give the doctor the ability to actually take action and maybe spend a little bit more time and offer a little bit more compassion. They're just wasting time with you yammering on about this or that or the other thing. So how can you as a patient help bring out the best in your doctor and that compassion in your doctor and create the best, most productive and satisfying experience for those 6 minutes that matter into
Yeah.
your life with the
So,
doctor?
so Kim, I think what's most important to me, and I may be a little bit different, is but understanding who you are, right? That doesn't take long, right? Just give me a couple sentences of who you are. Where are you from? What do you do? And tell me something about you. That means something to me, right? And then the second thing is for the patient to impress on the physician that they're not giving up, and that the reason they need this to happen in this manner is because they have goals, they have things they still got left to do, and they need certain abilities
Yeah.
to function appropriately in order to attain those goals, right? That means, these, you were telling me a second ago that the young lady who wanted to play the piano. I've got a
Yeah.
patient who just wanted to feed his ducks. I've got a patient who just wanted to do the farm life with his sons, right? That plays into it. And when I'm working, I'm thinking about it. And it's interesting because I tell my team this. And Kim, there are several times I'm standing at the table and I'm like, God knows this is killing me. And my team member, my tech beside me, or my nurse is going, George, you got this. Get pull your pants up, get back to the table, and let's get this job done. Right. Or
Yeah.
vice versa. Right. Because sometimes my tech or my nurse sort of goes, God knows you thinking this. I'm saying, listen, this person needs to do this. We got to do this. Then they get close to the table and they become engaged again. So it makes it real. It makes it human.
Yeah.
So
That was beautifully said. And I think that that also hits home for a lot of people. And it makes them feel more comfortable and it humanizes the doctor and humanizes the clinician. And I think it's important for them to understand. And I try to convey it to our patients that for those of you true CLI operators, the critical limb ischemia operators, critical limb threatening ischemia, CLTI operators, the ones committed to advanced limb salvage techniques, you're a special breed. I mean, you literally putting your life on the line to save someone's limbs because of the exposure to the radiation for very long periods of time. And so that's why I don't blame some doctors just are not willing to do that. And that's fine. It doesn't make them any less of a doctor. It's just choose your lane and what you do. And you're not a limb salvage specialist. You can open arteries, great, but you're not, committed to the 2, 3, 4, sometimes 5 hours it may take to eke your way through the most complex concrete in the arteries. So we appreciate each and every one of you for everything you do every single day. But I want to ask you a funny question before we close out here.
uh,
And I was afraid to continue. I was telling Dr. Banaka yesterday during our interview um, that I was afraid to do this question because there was a situation with a TikTok video at an OBGYN that went viral where the clinicians um, focused on what women leave behind at their appointments and showed them grossing out, their tongue out, and things. And women are already nervous about going um, to their appointments and having those things happen in the first place. That's why many don't. So that's why I feared asking this question because the patients want this. And I just, so keep that in mind. It's not, the question I'm going to ask is not about making fun of anyone. It's the patients really want to learn, what not to do, what they shouldn't say or should say. And it's not to censor them or to get them nervous, but they like to laugh at themselves a little bit. And I'll give you an example. We asked Dr. David Alper this question, and it's a moment where a patient still has you shaking your head. That's something that patients can learn from, mistakes they make, something they can learn from. It can even be, I can't believe my patient just said this or did that. But do it in your compassionate, respectful way. He shared that there was a diabetic patient, and we understand that diabetics end up with the neuropathy where they can't feel. And she was having trouble keeping her socks up, and she tried tape, she tried rubber bands, and she was said that she was so proud of herself when she found that staples actually worked and didn't hurt, until the point when she ended up with wounds that were out of control and was almost on deck for amputation. And that was a good lesson. He said, please do not staple your legs. Not a good thing. So you might think, oh my God, why would anyone think to do that? But people have creative solutions. We have people in the Philippines that use bleach to clean their wounds. That's an absolute no no. But people do it. So you just have to say, even if you can't believe that you need to say, you just have to say it. So, with that being said,
So, okay,
good luck to you.
you want to be tickled? Here we go. All right, so I'm always asking patients to lose weight, right? I think it's probably one of the hardest things to do. It's probably harder than stopping smoking.
Yeah.
But if we can lose weight, we can control our risk factors of diabetes, high blood pressure, high cholesterol. Well, I had this gentleman come in, and he was a patient, and he took it and he goes, listen, I'm going to do it. Well, he got with a group of his friends, and they figured that the way they would do it is by these cleanses. I don't know if you know about cleanses, right?
Yep.
I had no idea, but these cleanses are where they, they, they go and regardless. So he tells me he's going to go do these cleanses. And so I said,
Okay.
okay. Well, about 2 weeks later, he comes into my clinic emergently. And asked him, I said, what's going on? He goes, listen, I don't know, I just feel awful. And so I got an electrocardiogram and he was in atrial fibrillation, right? And he was going at a very fast rate. I cardioverted him, got him back in normal rhythm. But I said, listen, I said, it's something must have triggered this, right? And and he goes, I don't know what it could be. Well, I said, listen, if you go home and you figure out what could have knocked you into atrial fibrillation, right? Because just about anything can that upsets the body, let me know. So 2 days later, I get this phone call. He goes, Doc, I figured it out. And I said, what is it? I go, what are you talking about? He goes, listen, that thing, this atrial fibrillation, you said if I figured out what triggered it, let me know, to let you know. I said, yeah, well, okay, what do you think it was? He goes, I think it was that weight loss strategy that me and my buddies were trying. I said, okay. I said, what do you mean? He goes, well, it was these cleanses, and I went out and bought these enemas. And I said, enemas? And I said, yeah. I said, well, what about these enemas? He goes, well, I didn't know that it wasn't supposed to be taken orally. Oh Lord. So I said, what do you mean? He goes, I said, wasn't there something called an applicator in there? Because it was supposed to be rectally that you give these enemas. Well, this poor guy had been taking it orally. He's lucky he didn't die. But similar to the young
Almost
lady.
triggered my reflex.
He definitely lost some weight, but he about killed himself doing it. But it just tickles me. Sometimes people, and it's like a kid. I mean, you can't get upset. I mean, you just realize, Lord have mercy, they just didn't know. So you take it in stride, and you just educate them and just move on. But yeah, so that'd be similar to the staples with the socks, but
Yep.
instead of an enema per rectum, it was an enema by mouth. So, I
Can't
can't
even
even imagine.
imagine
Uh,
like preparing for a colonoscopy and having to drink that stuff. I mean,
yep.
oh, oh my God, that's just awful. But yes, please do not try that at home. And thank you for ending on that note. And I want to
Yeah.
end on one other story that this is near and dear to my heart with you, Dr. Adams. I know we share so many, and every one of our story, it's always a really, right here type of story. And I got a call on Mother's Day this year from a patient who was just beside herself, scared to death that she was told she had a 5 centimeter aneurysm. And she goes on Dr. Google and she has what she thinks are symptoms because of it. And she's scared. And it's also on Mother's Day. And I have, lost my mom due to an aortic aneurysm that they missed. So it's something that is very personal to me, and all of my patients know that story very, very, very well. And we have Joshua as our producer here, and he works with Aortic Hope, which deals with aneurysms. And so it's just very personal. And Dr. Adams, I just sent out a plea because she was in North Carolina, and I said, I don't know what to do. I'm scared for this patient, and this is something personal to me. And he literally just took the bull by the horns, was like, I'm contacting my colleague. We're going to get her in right away. It eased her concerns, and she was seen. It turns out that she did need a procedure to replace that sooner rather than later, but it was because of Dr. Adams' kind heart on Mother's Day, your compassion and care, that we were able to help this patient. It would have been so easy for you to say, well, you're not at my hospital. You're not calling from the emergency room. You're the Global PAD Association. Why are you calling me about aortas? And you didn't. You, deep at your core, are a, just a fantastic human on this planet. And I would even say you're truly an angel, Dr. Adams. And I mean that with everything. So congratulations, well deserved. 2025 Compassion and PAD Care Award winner, Dr. George Adams. We appreciate all of who you are and what you do to save life and limb.
Thank you, Kim. Means a lot.